In this video, I'm about to show you the largest hospice fraud scheme in California history. 21 people just got charged. $267 million stolen from Medi-Cal, that's California's Medicaid program. This wasn't a small operation. This was a massive criminal enterprise that enrolled thousands of patients who weren't dying, who weren't even sick, who had no idea they had been listed as terminal. And they got away with it for nearly a decade, until it finally collapsed. Let's get into it. The Department of Justice announced in late 2024 that a massive hospice fraud network operating across Southern California had been completely dismantled. The network, operating under multiple shell company names including Pacific Hospice Group, Golden State Palliative Care, California Comfort Care, and Angels of the Valley, bilked Medi-Cal out of an estimated $267 million over 8 years. Let me put that number in perspective. $267 million. That's enough to fund hospice care for over 30,000 terminal patients. Instead, it went to luxury homes, sports cars, private jets, and offshore bank accounts. The DOJ has charged 21 people so far. The masterminds were Dr. Lawrence Chen, a 71-year-old physician from Newport Beach, and his wife Susan Chen, a former nurse who managed the business operations. Also charged were 6 other physicians, 8 nurses, 4 marketing executives, and 2 billing specialists. According to the unsealed indictment, this network enrolled over 5,000 patients into hospice programs, patients who did not meet hospice eligibility requirements. Some patients had minor conditions like high blood pressure, some had seasonal allergies, some had no documented medical conditions at all. But they were all listed as having terminal illnesses: lung cancer, pancreatic cancer, end-stage heart failure, Alzheimer's disease. Here's what makes this scheme different. They didn't just target Medicare. They targeted Medi-Cal, California's Medicaid program for low-income residents. Medi-Cal patients are some of the most vulnerable people in our society. They're elderly, they're poor, they're disabled, and the Chens saw them as ATMs. One victim, Maria Hernandez, a 68-year-old woman from East Los Angeles who speaks limited English, was enrolled in a Pacific Hospice program for 3 years. She had no idea. She had never received a single hospice visit. She didn't even know what hospice meant. When an investigator interviewed her through a translator, she said, "I thought hospice was for people who are dying. I'm not dying. I just have diabetes." Her daughter translated for her. The daughter was crying. She told the investigator that her mother had been terrified for years, thinking she had a terminal illness that no one was telling her about. She had stopped making plans. She had stopped seeing friends. She lived in fear every single day because Dr. Lawrence Chen needed to hit his enrollment numbers. Let me walk you through exactly how this $267 million fraud operated, because it was one of the most sophisticated ever prosecuted. The Chens built a network of over 15 separate hospice locations across Southern California: Los Angeles, Orange County, Riverside, San Bernardino, San Diego, Kern County, Fresno, and even as far north as Sacramento. Each location had its own Medicare and Medi-Cal provider numbers. This allowed them to spread their fraudulent claims across multiple billing identities, making it much harder for auditors to detect the pattern. Here's what they did. First, Susan Chen managed a team of patient recruiters, marketing executives who targeted low-income senior communities. They went to Section 8 housing complexes, adult daycare centers, and community health clinics. They offered seniors free benefits and extra services they didn't know they qualified for. They never once mentioned that enrolling in hospice means waiving standard Medi-Cal benefits for any treatment related to your terminal diagnosis. One recruiter, Carlos Mendez, was recorded telling a senior, "It's just a paperwork thing. Everyone qualifies. You just need to sign here." He was paid a bonus of $1,000 for every patient he enrolled. Over 8 years, Mendez personally enrolled over 800 patients. He made over $800,000 in bonuses alone. Second, once patients were recruited, Dr. Lawrence Chen and his network of corrupt physicians falsified medical records. They created fake terminal diagnoses, they backdated certifications, they forged the signatures of other physicians who had never met the patients. The indictment includes evidence that Chen personally signed over 6,000 hospice certifications between 2016 and 2024. That's nearly 2 per day, every day, including weekends and holidays, for 8 straight years. Third, once patients were enrolled, the network billed Medi-Cal for daily hospice care, over $200 per patient per day, but most patients never received any care. The nursing notes were all identical, copy and paste, written by supervisors who had never visited the patients. One nurse, Jennifer Walsh, who later became a whistleblower, testified that she was required to fill out daily nursing notes for patients she had never met. When she complained, Susan Chen fired her. Fourth, the network billed for expensive medications that were never provided. Hospice patients are entitled to medications related to their terminal diagnosis, so the network billed Medi-Cal for thousands of dollars worth of painkillers, anti-nausea drugs, and other medications, many of which were never dispensed. Some were dispensed and then resold on the black market. The indictment includes evidence that the network billed Medi-Cal for over $50 million in medications over 8 years. An audit found that less than 5% of those medications were actually provided to patients. The rest were either never ordered, never delivered, or were diverted. And here's something the media isn't talking about. The Chens didn't just defraud Medi-Cal, they also enrolled patients in private insurance plans through Medicare Advantage. Those plans pay even more than traditional Medicare, sometimes $300 to $400 per patient per day. The indictment includes evidence that the Chens network billed private insurance companies for an additional $70 million on top of the $267 million from Medi-Cal. That brings the total fraud to over $337 million. $337 million. That's enough to fully fund a small hospital for a year. Instead, it went to yachts, luxury cars, and offshore accounts. And here's the part that really gets me. The Chens claim to be non-profit organizations. Pacific Hospice Group was registered as a non-profit. They paid no taxes, they qualified for special grants. They even received federal COVID relief funds, over $2 million, that were supposed to help hospice workers during the pandemic. Those workers never saw a dime. The Chens pocketed it. That's not fraud. That's theft from taxpayers, from patients, and from the healthcare workers who actually do the work. Dr. Lawrence Chen was a respected physician. He had been practicing medicine for over 40 years. He was board certified in internal medicine and geriatrics. He had admitting privileges at 5 hospitals. He had published papers, he had taught at medical schools, and he used all of that credibility to build a $267 million fraud machine. According to the indictment, Chen was paid over $15 million in salary and bonuses over 8 years. He also owned the real estate where several of the hospice locations operated and charged rent to his own companies, a separate stream of fraudulent income. Chen used the money to fund an extravagant lifestyle. He bought a $7 million home in Newport Beach. He owned 3 luxury cars, a Ferrari, a Porsche, and a Mercedes. He owned a vacation home in Aspen, Colorado. He owned a yacht docked in Newport Harbor. He took private jets to Europe and Asia. He spent over $500,000 on a single birthday party for himself at a hotel in Beverly Hills. Susan Chen managed the business operations. She had been a registered nurse but let her license lapse in 2005. She didn't need it anymore. She was the one who recruited physicians, hired marketers, and managed the billing. Her salary was over $2 million per year. The Chens were arrested at their Newport Beach home in August 2024. FBI agents executed a search warrant at 6 in the morning. They found Dr. Chen in his robe, trying to delete files from his laptop. They found Susan Chen in the kitchen, shredding documents. They found over $2 million in cash in a safe in the master bedroom closet. Both are being held without bail. The judge called them serious flight risks and a danger to the community. Dr. Chen's medical license has been suspended. They face charges of healthcare fraud, conspiracy to commit wire fraud, money laundering, kickback violations, and obstruction of justice. Combined, they could face over 100 years in federal prison. Here's a detail that didn't make most news reports. When the FBI raided the Chen's Newport Beach home, they found a wall of framed photos. Dr. Chen with politicians, Dr. Chen at charity galas, Dr. Chen receiving awards from medical associations. One photo showed him shaking hands with a California state senator. Another showed him accepting a Humanitarian of the Year award from a local hospice foundation. He was photographed with the award while his company was actively defrauding Medi-Cal of hundreds of millions. The same man who listed healthy seniors as dying was being celebrated as a humanitarian. The FBI seized those photos as evidence. They're now part of the criminal case. Dr. Chen's lawyer has asked to have them returned, calling them personal mementos. The judge denied the request. They're evidence of a public image built on lies. That's what makes these cases so infuriating. These people don't look like criminals. They look like pillars of the community. Until you see what's behind the wall of photos, Dr. Chen didn't do this alone. He recruited 6 other physicians to sign certifications. For each certification, the physicians were paid $500 to $1,000. Over 8 years, these 6 doctors signed over 10,000 certifications between them. Dr. Robert Kleinman, no relation to the Kleinman from other cases, was a 73-year-old physician from Sherman Oaks. He signed over 2,000 certifications. He told investigators that he trusted Dr. Chen and didn't review the charts carefully. He's charged with healthcare fraud and faces up to 20 years. Dr. Patricia Miller was a 68-year-old physician from Santa Monica. She signed over 1,800 certifications. She admitted to investigators that she sometimes signed stacks of blank forms that were mailed to her office. She's charged with conspiracy and faces up to 15 years. Dr. James Wong was a 65-year-old physician from Irvine. He signed over 1,500 certifications. He was paid over $1 million for his signatures. He's charged with healthcare fraud and money laundering and faces up to 30 years. These doctors all had one thing in common. They stopped practicing medicine years ago. They kept their licenses active just to sign hospice certifications. They were, in essence, professional signature for hire physicians, and they got rich doing it. The California Medical Board has suspended all 6 licenses. These doctors will never practice medicine again, but that doesn't bring back the $267 million. Jennifer Walsh was the nurse we mentioned earlier. She was hired by Pacific Hospice Group in 2021 as a patient care coordinator. Within weeks, she realized something was terribly wrong. She was assigned over 100 patients. She was told to document daily visits, even though she never visited any of them. She was given pre-filled nursing notes, all identical, and told to sign them. She was told to ignore patients who called with complaints. When she confronted Susan Chen, Chen told her, "That's how hospice works. The patients don't know the difference. They're old. They're not going to remember if a nurse visited or not." Walsh quit the next day, and then she called the California Department of Justice. She provided copies of patient files, billing records, and emails. She identified specific patients who were not terminally ill. She provided the names of recruiters who were targeting vulnerable seniors. The investigation took 3 years. 3 years of interviews, subpoenas, search warrants, and forensic accounting. But in August 2024, the hammer finally dropped. 21 people were arrested, all at once, at their homes at 6 in the morning. Walsh is eligible for a whistleblower reward of up to 30% of what the government recovers. In this case, that could be up to $80 million. But Walsh told reporters that she didn't do it for the money. She did it because, in her words, "I couldn't sleep at night knowing that dying people were being neglected while the executives got rich off their suffering." Let me tell you about some of the 5,000 victims, because this is the part that should make you furious. Elena Vasquez, a 74-year-old woman from Boyle Heights, was enrolled in a Pacific Hospice program for 4 years. 4 years. Hospice is for 6 months. She had no terminal diagnosis. She had arthritis and high cholesterol. That's it. Pacific Hospice billed Medi-Cal for her for 48 months, over $300,000. She had no idea she was in hospice until a federal agent knocked on her door. William Johnson, a 69-year-old man from San Bernardino, was enrolled for 3 years. He had high blood pressure. He was still working as a security guard. Pacific Hospice listed him as having terminal lung cancer. He had never had a chest X-ray. Rose Martinez, an 81-year-old woman from East Los Angeles, was enrolled for 5 years. 5 years. She had mild cognitive impairment, but mild cognitive impairment is not a terminal diagnosis. She could live for another 20 years. Pacific Hospice listed her as having terminal Alzheimer's disease. She didn't have Alzheimer's, she was just getting older. Thomas Reed, a 72-year-old man from Fresno, was enrolled for 2 years. He had diabetes, he was still active, still drove, still saw his grandchildren. Pacific Hospice listed him as having terminal pancreatic cancer. He had never seen an oncologist. And let me tell you about the patients who actually died during this scheme, because that's the part that haunts me. Real patients with real terminal illnesses were enrolled in the Chen's hospices. But because the network was understaffed, they had 3 nurses for over 500 patients at one point. These dying patients received almost no care. Family members reported that their loved ones were in pain, that no one returned phone calls, that nurses rarely showed up. One family, the Wilsons from Riverside, told investigators that their father spent his last 3 days in agony because no hospice nurse came to adjust his pain medication. The family called the hospice hotline 8 times. No one responded. Their father died in pain. The Chens were in Aspen that week. That's the real cost of this fraud. It's not just money. It's human suffering. It's people dying in pain because the people who were supposed to care for them were too busy counting their money. The DOJ is seeking enhanced sentencing for the Chens based on patient harm. They could face life in prison. The investigation into the Chen's network started with that whistleblower, Jennifer Walsh. In 2021, the California Department of Justice opened a file. Within months, they had referred the case to the FBI. The FBI spent 3 years building the case. They interviewed over 400 witnesses. They subpoenaed bank records, phone records, and email servers. They executed search warrants at all 15 hospice locations simultaneously. At the Newport Beach location, the main office, they found boxes of patient files, over 5,000 of them. Most contained forged signatures and fake diagnoses. They also found evidence of a cover-up. In 2023, after learning that the FBI was asking questions, Susan Chen ordered her staff to shred patient files and delete emails. The FBI recovered shredded documents from a dumpster behind the office. They also recovered deleted emails from the company's backup servers. Susan Chen faces an additional charge of obstruction of justice. She could face up to 20 years just for that. After watching this, you might be wondering, could this happen to someone I love? The answer is yes. Here's what you need to know. Hospice is for people with a terminal diagnosis, 6 months or less. If a hospice contacts you out of the blue, be suspicious. Legitimate hospices get referrals from doctors, not cold calls. Ask questions. What is my diagnosis? Which doctor certified me? Why do I qualify for hospice? If you don't have a terminal illness, you don't belong in hospice. Check your Medi-Cal or Medicare statements. Look for hospice claims. If you see hospice charges for someone who isn't in hospice, report it immediately. The number to call is the HHS OIG hotline, 1-800-HHS-TIPS. That's 1-800-447-8477. You can report anonymously. If you have a loved one in hospice, visit them. Ask to see their care plan. Ask to meet their nurse. If something seems wrong, speak up. $337 million. That's the true size of this fraud when you include the private insurance billing. But that number doesn't capture the human cost. Think about the 5,000 patients who were told, or not told, that they were dying. Think about their families. Think about the years of fear, anxiety, and grief that could have been avoided. Think about the real hospice patients, people with actual terminal illnesses who were turned away because the Chen's network had filled their slots with fake patients. The DOJ is cracking down. In 2024 alone, they've announced charges in over 30 hospice fraud cases nationwide, total fraudulent billing over $1 billion. But for every case that gets caught, how many are still operating? The Chens thought they wouldn't get caught. They were wrong. They're sitting in cells right now, waiting for their trials. Their assets have been seized. Their medical licenses are suspended. They'll almost certainly go to prison. One more thing before I go. The California Department of Justice has launched a new task force specifically targeting hospice fraud. They've hired 30 new investigators. They've partnered with the FBI and HHS OIG. They've created a dedicated hotline for hospice fraud reports. The number is 1-800-MED-FRAUD. That's 1-800-633-3728. If you see something, say something. These fraudsters are counting on your silence. Don't give it to them. The Chens stole $337 million. That money could have paid for real hospice care for tens of thousands of terminal patients. Instead, it's sitting in seized bank accounts waiting to be returned. It will take years. But it's coming back. And the Chens are going to prison. That's the only justice there is. That's justice. Slow, imperfect, but justice. But it only happened because one nurse, Jennifer Walsh, decided to speak up. One person who refused to look the other way. We need more people like her. If you see something, say something. Report fraud. Protect the system that millions of Americans rely on. I'll see you in the next one.